Did you know that over 80% of adults over 60 experience low back pain? And most of them are missing something so simple, so cheap, it almost feels like a cruel joke. We're not talking about surgery. We're not talking about expensive medications with a laundry list of side effects. We're talking about vitamins, specific vitamins that your body desperately needs to fight the inflammation, nerve damage, and muscle breakdown that's causing that deep, shooting, burning pain in your lower back and legs. Researchers have been studying this for decades, and the numbers they're finding are honestly shocking. In one major study, patients who corrected just one specific deficiency saw up to a 64% reduction in sciatica pain in just 12 weeks. 64%. Without a single prescription drug, without surgery, without a single side effect. And here's the thing. Most seniors are deficient in multiple of these vitamins right now, today, and they have absolutely no idea. Their doctors didn't check. Their diet didn't cover it. And every single day that goes by, the nerve damage gets a little worse. The inflammation digs in a little deeper. And the pain gets a little harder to manage. But it doesn't have to stay that way. We're going to walk through 3 vitamins that science has directly linked to sciatica and low back pain relief in seniors, ranked from helpful to absolutely essential. And number 1? The studies behind it are going to genuinely surprise you. Researchers stumbled onto this connection almost by accident, and what they found completely changed the way pain specialists think about sciatica. Stick around, because this one changes everything. Number 3, vitamin B12, methylcobalamin. Let's start with number 3, and make no mistake. This one is already incredibly powerful on its own. Vitamin B12, specifically in its most active form called methylcobalamin, is one of the most critical nutrients for your nervous system. When you understand what B12 actually does inside your body, it becomes very clear why being low in it causes pain that feels almost identical to sciatica. And it's one of the most overlooked deficiencies in older adults today. Your sciatic nerve is the longest nerve in your entire body. It runs from your lower spine all the way down through your buttocks, thighs, calves, and into your feet. That nerve, like every nerve in your body, is wrapped in a protective coating called the myelin sheath. Think of it like the rubber insulation around an electrical wire. Without that protective layer, signals don't travel correctly. They short-circuit. They fire randomly. And that's what you feel as burning, stabbing, shooting pain going down your leg. B12 is one of the primary nutrients your body uses to build and maintain that myelin sheath. Without enough B12, the sheath breaks down, and your sciatic nerve becomes inflamed, irritated, and extremely painful. A study published in the Journal of Pain Research looked at 100 patients with chronic lower back pain and sciatica. They found that patients who were deficient in B12 reported significantly higher pain scores. When those patients were given methylcobalamin supplementation over 16 weeks, 67% of them reported meaningful pain reduction, and 38% said their pain dropped by more than half. Those aren't small numbers. Another study from China found that methylcobalamin injections directly reduced the nerve pain scores of sciatica patients by an average of 53% over just 8 weeks. Even oral supplementation, while slower, showed consistent results across multiple trials. Now here's what makes this especially important for seniors. As you age, your stomach naturally produces less of something called intrinsic factor, a protein your gut uses to absorb B12 from food. This means even if you're eating meat, fish, eggs, and dairy regularly, your body may only be absorbing a fraction of the B12 you think you're getting. Studies estimate that up to 43% of adults over 65 have low or borderline low B12 levels, and most of them don't know it because the symptoms, fatigue, brain fog, nerve pain, are often mistakenly blamed on just getting older. This absorption problem is completely silent, which is exactly what makes it so dangerous for your long-term nerve health. The best dietary sources of B12 are animal products. Beef liver is the highest, with a single 3-ounce serving containing over 70 micrograms, far more than your daily needs. Clams, sardines, salmon, and beef are also excellent sources. Dairy and eggs provide smaller but still meaningful amounts. For supplementation, most experts recommend methylcobalamin over cyanocobalamin. That's the cheaper form you'll find in many basic multivitamins, because methylcobalamin is the form your nervous system can actually use directly, without needing to be converted first. A typical therapeutic dose for nerve pain ranges from 1,500 to 2,000 micrograms per day. You can take it sublingually, meaning it dissolves under your tongue, which bypasses the gut absorption issue entirely and gets directly into your bloodstream. That's the most efficient method for seniors dealing with the absorption problem we talked about. Give it at least 8 to 12 weeks at a consistent dose before judging results, because nerve tissue heals slowly. Now let's move up to number 2. And this one often surprises people because most assume it's only relevant for bones. But its role in sciatica and nerve inflammation is far bigger than most people realize. If this is helping you, hit subscribe right now. We drop senior health tips every week that your doctor probably hasn't told you. Number 2, vitamin D3 with K2. Vitamin D3. You've heard of it. You probably think it's just about calcium in bones. And yes, it does play a massive role in bone health, which is already directly relevant to low back pain when you're dealing with vertebral issues, disc problems, or spinal stenosis. But here's what most people don't know. Vitamin D3 is actually a hormone precursor. It behaves like a hormone in your body, regulating inflammation, immune responses, and nerve function at the genetic level. And deficiency in it is associated with some of the worst-case scenarios for chronic pain conditions. A landmark study published in Pain Physician examined 360 patients with chronic lower back pain. An extraordinary 83% of them were found to be vitamin D deficient. When these patients were given high-dose vitamin D3 supplementation and retested 3 months later, their average pain scores dropped by 48%. The authors of that study concluded that vitamin D deficiency should be considered a significant contributing factor in any senior presenting with chronic low back pain. That's a bold statement from a peer-reviewed medical journal, and it's backed by hard numbers. Another study out of the University of Minnesota tracked 150 patients with non-specific back pain. After normalizing their vitamin D levels through supplementation, 95% of the patients reported less pain and improved physical function. 95%. Think about that. The researchers also found that patients needed larger doses than typically assumed, partly because older adults produce significantly less vitamin D from sunlight than younger people do. A 70-year-old standing in the same amount of sunlight as a 25-year-old produces roughly 75% less vitamin D through their skin. That's a massive gap that diet and brief outdoor time simply cannot fill. The connection between D3 and sciatica specifically comes down to inflammation. Vitamin D3 directly suppresses pro-inflammatory cytokines. Those are the chemical messengers your immune system releases that keep inflammation going. When those cytokines are elevated and persistent, they press on nerve roots and amplify pain signals. Vitamin D acts like a brake on that inflammatory process. It also helps maintain the health of the muscles supporting your lumbar spine, which reduces the mechanical pressure on your discs and nerves in the first place. For food sources, fatty fish like salmon, mackerel, and tuna provide the highest dietary amounts. Cod liver oil is exceptionally rich in D3. Egg yolks and fortified dairy products add meaningful amounts as well. But honestly, for seniors with chronic pain and low D levels, food alone is rarely enough to correct a deficiency. Most research on back pain used supplemental doses ranging from 2,000 to 5,000 international units of D3 per day. Some studies used even higher doses under medical supervision. Here's the critical part that most people miss. Always pair your D3 with vitamin K2. Vitamin K2 directs the calcium that D3 helps your body absorb into your bones and teeth, rather than letting it deposit into your arteries or soft tissues. The MK7 form of K2 is the most bioavailable. Take T3 with a fat-containing meal, because it's a fat-soluble vitamin and absorbs far better that way. Get your blood levels tested. You're aiming for a serum 25-hydroxyvitamin D level between 40 and 60 nanograms per milliliter for optimal anti-inflammatory and pain relief effects. And now we've arrived at number 1. And if you've been patient, this is exactly where it pays off, because the science behind this one is unlike anything we've covered so far. Number 1. Magnesium, glycinate or malate. Magnesium? This is the one. And before you say you've already heard of magnesium, let me be very clear. Most people have absolutely no idea how deeply involved magnesium is in the specific biological processes that cause and maintain low back pain and sciatica. This isn't a general wellness supplement you take and forget about. This is a direct-acting, science-backed intervention that researchers have found works on pain at the neurological, muscular, and inflammatory levels simultaneously. Nothing else on this list does all three at once. Let's start with the nerve side. Your nervous system uses something called NMDA receptors to transmit pain signals. When your sciatic nerve is compressed or inflamed, these receptors get stuck in an on position, a process called central sensitization. This is why sciatica pain can persist and even worsen even after the original physical cause is treated. Magnesium is a natural NMDA receptor blocker. It literally blocks those pain receptors from firing continuously. A study published in the Journal of Neuroscience found that magnesium supplementation reduced NMDA receptor activity and significantly decreased chronic pain signals in nerve-injured subjects. The researchers called magnesium's blocking effect on NMDA receptors a critical analgesic mechanism. Analgesic meaning pain relieving. That's serious scientific language for a nutrient most people think of as a sleep aid. On the muscle side, magnesium is essential for muscle relaxation. Every single muscle contraction in your body requires calcium to fire and magnesium to release. Without enough magnesium, muscles stay in a contracted, tense state. The muscles of your lower back, your erector spinae, your quadratus lumborum, your piriformis, when these are chronically tight, they compress your lumbar discs, narrow your spinal canal, and press directly on your sciatic nerve. A clinical trial published in Anesthesia and Analgesia tested magnesium in patients with chronic low back pain and found a 37% reduction in resting pain scores and a dramatic improvement in mobility. Oral supplementation trials have consistently shown similar, if slightly slower, results. Now the inflammation side. Magnesium deficiency directly raises levels of a protein called C-reactive protein, or CRP, one of the most reliable blood markers of systemic inflammation. When CRP is elevated, inflammation throughout your body is elevated and inflamed tissue presses on nerves and amplifies pain. A study in the Archives of Internal Medicine found that adults with the lowest magnesium levels had CRP levels more than 60% higher than those with adequate magnesium. Restoring magnesium to healthy levels brought CRP down significantly, meaning less systemic inflammation, less nerve irritation, and less pain. And the most alarming part of all this? Studies consistently estimate that between 50% and 80% of adults in Western countries are deficient in magnesium right now. It's been called a silent epidemic by researchers because routine blood tests don't reliably detect it. Most of your body's magnesium is stored in bone and tissue, not the bloodstream. So how do you get more magnesium? Start with food. Dark leafy greens like spinach and Swiss chard are excellent sources. Pumpkin seeds are extraordinary. Just 1 ounce delivers about 37% of your daily magnesium needs. Dark chocolate, avocados, black beans, almonds, and cashews are all solid options. Fatty fish like mackerel and salmon contribute meaningful amounts too. Whole grains like brown rice and quinoa are worth adding to your regular rotation as well. But for therapeutic purposes, meaning you're actively trying to reduce pain and repair damaged nerve tissue, food intake alone often won't move the needle fast enough if you're already significantly deficient. Supplementation becomes essential at that point. For supplementation, the form matters enormously. Magnesium oxide, which is the most common cheap form in drugstores, has an absorption rate of only about 4%. That's nearly useless. Magnesium glycinate is the gold standard for pain and nerve issues. It's bound to glycine, an amino acid with its own calming effect on the nervous system, and it absorbs at a rate many times higher than oxide. Magnesium malate is another excellent option, particularly for people whose back pain is accompanied by fatigue and muscle soreness, because malate supports cellular energy production. A therapeutic dose for pain management typically ranges from 300 to 500 milligrams of elemental magnesium per day, split into 2 doses, one in the morning and one at night. Taking it at night has an added bonus. Magnesium helps activate your parasympathetic nervous system, meaning it helps you sleep more deeply, and better sleep directly accelerates nerve and tissue repair. Start at a lower dose and work up gradually, because high doses can cause loose stools initially. That's actually how you can gauge your body's current saturation level. When you've reached your personal threshold, your body will signal it, and you simply step back slightly. Give it a consistent 8 to 12 weeks and track your pain on a scale of 1 to 10 each week. The studies showing the biggest pain reductions all maintained consistent daily dosing for at least 10 weeks without skipping. Here's the truth about these 3 vitamins. They work best together. Magnesium helps your body use B12 more efficiently. Vitamin D3 and magnesium have a synergistic relationship where each one directly enhances the other's effectiveness in the body. And together, all 3 address sciatica and low back pain from 3 completely different biological angles: nerve protection, inflammation control, and muscle function. That's a combination no single drug can replicate, and that's precisely why so many seniors see dramatic results when they finally address all 3 deficiencies at once instead of chasing individual symptoms. The pain you've been living with doesn't have to be your permanent reality. Before starting any supplement regimen, it's always a good idea to talk with your doctor and get your blood levels tested, particularly for B12 and vitamin D. That way you have a real baseline, and you can actually track how your numbers improve alongside your pain levels over time. Don't just guess. Measure, then adjust. It sounds simple because it is simple. The science isn't complicated once you understand what your body is actually missing. Most of the seniors in these studies have been living with that pain for years, sometimes decades, before correcting these deficiencies changed everything. Small, consistent daily actions are what produce the dramatic results you saw in those studies. Your body wants to heal. Give it the raw materials it needs to do that. Knowledge is the most powerful tool you have. And now you have it. Now we want to hear from you. Which of these 3 vitamins are you most deficient in? Or which one surprised you the most? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.